graduated from Monash University in '92. When I first graduated, we had to work in the hospital system for many years, so that was long, hard shifts. Once that was behind me, then I started general practice. That's about the time I had my kids. And then we opened up this clinic where it gradually evolved. I did a lot of study after that. So I did a lot of skin cancer medicine and aesthetic medicine. And now we've evolved into a combination clinic with lots of services that we can do to help patients. When I was asked this question, I didn't really know what to say, so I asked my daughter, and she said, well, say that you're really friendly and you connect with people quite well, which I thought about it, and she was right. So I can talk to anybody of any age, of any background, and make friends with them. And I think that really helps me with my work, because people then trust me and I can advise them to get the best possible outcome. So when I see different businesses, I use that as a learning experience to improve my own, because I want to have patients go home from here happy. One of our happiest memories is going to Disney World. When we went there, we found the people that work there were really friendly, and they made us feel really, really special. And that's the sort of experience I'd like my patients to have. So when they go home, okay, they have a great outcome, but they also have a warm, fuzzy feeling that I'm really glad I went there. Well-being for me is healthy mind and healthy body, and I spend a lot of my time at a personal level as well as a professional level looking after myself. I like to practice what I preach, so I do exercise 6 to 7 days a week. I spend a lot of my time cooking for my family to make sure they get a nice range of different nutrients, and I guess spending time with family to maintain that mental well-being as well. So I think from the cosmetic point of view, I think if patients are looking well, so sometimes I get very athletic patients who have very fit bodies, but then their faces get depleted of volume and they actually look tired and they look unwell. So by replacing them, by replacing the volume, they actually feel better, and the productivity comes in their personal and professional lives. Well, I've got everything. I've got a great family, I've got a great job, I've got a great support team, so I can't really ask for more. I guess I was really happy when I graduated as a doctor, because it was a long, hard road for me, and having my kids was great. I do try and seek out education, so I do try and spend time to keep learning and upskilling. Because I find that if I go to a conference on the weekend, Monday morning I'll be back and using that skill and to give me better and better outcomes. I've noticed over the years that's one of the better benefits of having experience. I've got a lot of experience, and I like to get consistent results and keeping it safe as well. So it's one thing is to get good results, but we also want to keep it very safe for the patient. And by taking the care during the treatment and having that educational background as a doctor, I find I can achieve that. Ever since I was in high school, I've always focused on my education. Then after I became a mum, I focused a lot on my kids, and I've always tried to balance the two. So in that, I guess a lot of time is spent looking after other people. And now I try to spend a little bit more time looking after myself, so I can do even a better job looking after my family members and my patients. I think not just cosmetic physicians, but just doctors in general, I think it's really important never to forget where you came from. At the end of the day, we're all human beings, and we need to, if you have a skill or have the intelligence to be able to make a difference to someone's life, do it. And do it without expecting anything in return, and always keep the patient's well-being in focus. And I tell my kids the same thing: if you're good at something, use it to help other people around you, and they'll always remember you. Well, my dad's a cardiologist. He worked at the Royal Melbourne, but he chose to go back to Fiji, where I come from, and he treated a lot of people from a very poor background, didn't get paid for it, but he was actually very happy to do it. And I guess looking at him, I see that he's got a true love for medicine and a true love for people, which he's able to combine really well. So that's an inspiration for me. So when I'm ever feeling tired or cranky, I just look at him and I think, just suck it up. I don't think the achievement is my own. As when I was a little girl, my parents helped me a lot into achieving what I can at school, and since I've been married, my husband's been very supportive. So it really is a team effort, and now I see my kids trying to be more like me, so they try and work really hard, they persevere, they don't give up, and I'm very proud that I could pass those qualities on to my kids. But it's a team effort, it's not an individual. I couldn't do it without them.